Emerging diseases, the health challenges humanity may face in the next 10 years. As our world continues to advance, new diseases and health challenges emerge, posing potential threats to global populations. Over the next decade, several novel diseases may arise, impacting human health significantly. In this video, we will delve into 10 potential diseases that could emerge in the near future, providing detailed descriptions of each and discussing their potential impact on humanity. Xenoinfections. With the increasing interconnectedness of our global society, the risk of zoonotic diseases crossing over to humans is heightened. Xenoinfections may result from close interactions between humans and animals, leading to the transmission of novel pathogens. These infections could include new strains of influenza, coronaviruses, or other viral diseases. Vigilant surveillance, robust animal health monitoring, and proactive public health measures are crucial to prevent and control the spread of such diseases. Antibiotic-resistant superbugs. The overuse and misuse of antibiotics have accelerated the emergence of antibiotic-resistant bacteria. In the coming years, it is anticipated that more bacterial strains will become resistant to current treatment options, rendering infections harder to treat and control. This rise in antibiotic-resistant superbugs poses a significant threat to public health, as it jeopardizes our ability to effectively manage common bacterial infections. Vector-borne diseases. The effects of climate change and urbanization can alter the distribution and prevalence of vector-borne diseases such as malaria, dengue fever, and Zika virus. Changes in temperature and precipitation patterns may expand mosquito habitats and modify their behavior, resulting in an increased incidence of these diseases in new regions. Adequate vector control measures, public awareness campaigns, and research on new prevention strategies are crucial to combat the spread of these diseases. Neurological disorders. As the average lifespan increases, the incidence of age-related neurological disorders such as Alzheimer's disease and Parkinson's disease is expected to rise. Additionally, the impact of environmental factors and lifestyle choices on neurological health may give rise to new neurodegenerative conditions. Research into effective treatment methods, early detection, and risk reduction strategies is paramount to mitigate the burden of these diseases on individuals and healthcare systems. Chronic respiratory conditions. Air pollution, smoking, and occupational exposures contribute to the rise of chronic respiratory conditions, including chronic obstructive pulmonary disease and asthma. Changes in air quality due to industrial activities, urbanization, and wildfires, coupled with exposure to new pollutants, may lead to a surge in these conditions in the coming years. Robust air quality regulations, smoking cessation programs, and public health initiatives are necessary to prevent and manage chronic respiratory diseases. Mental health disorders. The fast-paced nature of modern life, coupled with the psychological impact of major events such as pandemics or natural disasters, can have long-term consequences on mental health. The next decade may witness a rise in mental health disorders, including anxiety, depression, and post-traumatic stress disorder. It is crucial to prioritize mental health services, increase access to mental health care, and promote mental well-being through comprehensive public health strategies. Drug-resistant tuberculosis. Tuberculosis remains a significant global health threat, and the emergence of drug-resistant strains, such as multi-drug-resistant tuberculosis and extensively drug-resistant tuberculosis, poses a serious challenge to disease control efforts. Strengthening healthcare systems, improving diagnostic capabilities, and developing novel treatment regimens are critical to effectively combat drug-resistant TB. Neglected tropical diseases. But before we move on to the topic, please like this video and subscribe to the channel. We will appreciate it and it will help to grow our channel. Despite progress in addressing neglected tropical diseases, several of these diseases persist and may even experience a resurgence in the future. Examples include Chagas disease, Leishmaniasis, and schistosomiasis, which primarily affect impoverished populations in tropical and subtropical regions. Continued investment in research, community engagement, and accessible healthcare services are necessary to eliminate these diseases and improve the well-being of affected communities. Metabolic disorders. Unhealthy diets, sedentary lifestyles, and rising obesity rates contribute to the increased prevalence of metabolic disorders like diabetes and metabolic syndrome. In the next decade, these conditions may continue to rise, placing a burden on healthcare systems worldwide. public health interventions that focus on promoting healthy lifestyles, nutrition education, and early detection can help alleviate the impact of metabolic disorders and improve population health. Environmental health risks. As humans continue to interact with the environment, new health risks may emerge. Environmental factors such as exposure to pollutants, radiation, or emerging contaminants can have long-term health consequences, including the development of new diseases or exacerbation of existing conditions. Comprehensive environmental monitoring, stringent regulations, and sustainable practices are crucial to minimize environmental health risks and protect human well-being. The future of global health presents dynamic and uncertain challenges. While we cannot predict the exact diseases that will emerge in the next decade, it is essential to remain vigilant and invest in robust surveillance systems, research, and healthcare infrastructure. By addressing emerging health challenges proactively, humanity can mitigate the impact of new diseases and work towards a healthier and more resilient future.